Welcome back to the RT Clinic, guys. We're going to show you today a little bit about what to do when a trach comes out. Bad news, cut to the intro. We've all been working before and you had your first trach patient. Get a little nervous beginning your shift because you're not really sure what could go wrong. Well, there's an easy fix for that. Show you the trach box, properly labeled by your respiratory therapy department. This is everything you need in the case of an emergency. Let me show you how we're going to use this thing a little bit. All right, so we're taking care of a patient, and this guy, it's unfortunate because he is headless, but he does have a trach in. Do we know what kind of trach that is? Let's take a look. All of you have seen this before. What is that? We've got a 6.0. We have a 6.0 Bavona in. Nice. So let's see what happens when this comes out. Now, remember, there's a couple keys to this. Number one thing that causes your trach to come out is the trach ties are not on there appropriately. Now, these are just kind of tied on. This isn't the standard one, but let's say this is how you find your patient. Now, it's really good to know at the beginning of your shift what kind of patients you have. So, is this a fresh trach, or have you had this for many, many years? That's going to give you the sense of urgency that you might need in this situation. So, you walk in, you hear some coughing, and bada bing, bada boom. This thing's usually lands something about like that, like it's supposed to be in that hole, but it's not in that hole. And they're breathing from their head, which this guy doesn't have one. So they're breathing up here through oropharynx. You may see some mucus, or maybe they're having a lot of difficulty breathing at this point. Really important thing that you need to do. So the respiratory therapist, first thing is hit your vocera or whatever you use to call your respiratory therapist. Call them immediately. The next thing is we're going to clue this hole and we're going to ventilate through their head. So that's where the trach box comes in. So trach box has a red lock on it. So we'll take it like this. There's a lot of stuff in here. You can see there's also an extra trach. That would be good for the respiratory therapist. We don't need that right now. We need this. Ambu bag, valve mask. We need that, and we need one more piece of equipment, and that would just be, it would be a gauze. Let's find us a piece of gauze. There we go, right here, a piece of gauze in here. So, what we're gonna do is we're gonna open up our bag valve mask. Get over there. We're gonna attach it to, and look, we have an adapter. This will go on here. We're not gonna do that though. Put the mask on. So we're going to attach it to oxygen, run it into 15 liters into this, and we're going to ventilate this patient. If they need it, we're going to ventilate this patient through their mouth. But the problem is, if I ventilate this gentleman through his mouth like this, every bit of the air you force into the lungs always goes past the least resistance. So the least resistance is going to be the stoma. So when that comes out the stoma, you're going to have some problems. That's why we have the gauze. So you're going to put the gauze over stoma, and you're going to ventilate that way. Now, ventilating a little too fast, you see this bag's deflated because I don't have it hooked up to oxygen, but don't look at those little minor things in the background. We're going to ventilate one breath every 5 seconds. 5 to 6 seconds is really good, and you're going to ventilate this patient. Now, when the RT shows up, they're probably going to look at either inserting another trach in this patient, or they're going to keep this occluded, maybe orally intubate, if we're having issues like that. But we do not recommend you go mouth to trach resuscitation. Don't do that. Or put your lips on it, unless you're like really hardcore. And to be honest with you, there's not a lot of respiratory therapists that would do that either. I would. Most of them won't. Mouth to stoma resuscitation. If you do that, you need to close their mouth and nose, pinch it, go in. There she is. She's nasty. Got to keep them alive. No, in all honesty, don't do that. Okay, that's just for dramatic effect. We cover this and we ventilate them through their mouth. So that was too fast. It's okay though. Critique me on the comments. So that's what the trach box is used for. We have a lot of stuff in here for suction and whatnot. Really, you need a gauze and you need a bag valve mask with a mask. Okay, make sure you keep the mask because you're going to be doing ventilation that way. So let me cut just a little bit here. I'll show proper ventilation techniques. So let's pull a different simulator over. Just as a review, let's pretend this gentleman here had a stoma. C and E. C, this part right here. E on the jaw. Think about pulling the jaw from the angle up into the mask. Up into the mask, pull the jaws up. Don't push the mask down. Okay? When you ventilate, you're going to ventilate until you see visible chest rise, and then stop. A lot of times it's not the entire bag. You don't have to crush the whole thing down. It's just ventilate and stop. So this is if your patient, trachs come out and now they are not breathing or they're having trouble breathing. This is how you're going to treat them. Review, we're going to open up the trach box, cover the stoma with a gauze. Do not reinsert the trach. I know it seems like it's just one hole, but it's really easy to go outside of the trachea, to get it in the tissue outside. I've seen it happen before. Not pretty. You stick that in the tissue outside the trachea, you attach the ambu to that, you give a couple of breaths, and you will have subcutaneous emphysema go from here whoosh, all the way up his head. And it's not a pretty sight because it goes subcutaneous air will go straight up, and then you got a problem because then your stoma is really closing off, possibly causing problems to the mouth for oral intubation. So do not reinsert the trach unless you're a trained professional and know how to do so. So the keys are cover with the gauze, bag valve mask, tell RT to get here ASAP. And just as a note, if you tell the RTs the trach came out, they usually come really, really fast. And not just one, but maybe like 3 or 4 of them. Because we really like those opportunities we have to reinsert a trach. It's pretty cool. So, just a little note for you. So, thanks for watching. See ya.